So what makes us different? We will look at all of it. If you went to high school and you graduated high school, they gave you a general education, right? But the one thing they forgot to teach you is how to live. We don't learn how to live. We don't know what to eat. We don't know what food is. We don't know when to go to sleep. We don't know if we should move around or not. We don't know anything. So we have seminars. Now, if you've traveled around, you'll notice that you'll never see a group of horses having a seminar about what to eat, or dogs. The animals don't have to, because they are under the auspices of instinct. Since we don't have instinct, we lost it, we eat whatever. So if you're in one part of the world, you might be eating live monkey brain. And if you're in another part of the world, you'll be eating bull testicles. If you're in another part of the world, you'll be eating the lining of the intestines, and or the psoas muscle of a cow, whatever, or plants, So anyway, so it depends. So we don't know what to eat. Horses, you can't get a horse to eat dog food, and you can't get a dog to eat horse food. They won't. They'll die first. We don't know what human food is. It's debatable. Yeah. It's not debatable. It's only debatable for those who don't know. Okay. So anyway, so that's what we work on. We teach you. You learn how. Okay. Of course, we give you the IVs like everyone does. The IVs we give are no different. Everyone gives a high dose of vitamin C. They give ozone. They maybe give artesunate. They maybe give curcumin, quercetin. There are a number of botanicals, intravenous botanicals and things like that. Yeah, but one thing we do there that's differently is we say, okay, what's our goal with vitamin C? Because I ask other places, what is your, how much do you give? Oh, we give 75 grams 3 times a week. All right, so are you accomplishing what you're looking for? How do you measure whether or not you achieved it? Anyway, we are into this detail, right? Boring that you don't want to know detail. But anyway, there is a thing. We have to know what your fasting ascorbate level is. We have to know blah, 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 blah. We have to know we achieved your plasma ascorbate level that's therapeutic. And how long was it there? 15 minutes, 30 minutes? Anyway, all that stuff, we're really into it. And can I give this therapy before I give that one? Oh, no, I should give it after. So all that sort of stuff we do that I don't see other places, and I've traveled. So anyway, number one. Number two, that's not the only thing. Because when you leave, you're not going to take those IVs with you. You're not going to take colonics with you. You're not going to take lymphatic therapy with you. All the thing you're going to take with you is who you have become and what you have learned. That's what you're going to take. So that we place a great emphasis on that. So we teach you, it's called the School of Life, because remember, we didn't learn how to live. And by the way, this is one school you do want to graduate from. So we teach you how to live, and we give you the reason. So at night, it's a whole series of teachings about sleep, about why movement is so important, about what is food. Well, if you ask me what is food, I'm going to have to ask you, what species are we talking about? I mean, because for a fly, it might not be what we want to eat. So let's first come up with the species, then we can discuss the food, right? So we talk about that. So we teach you all that so you have the foundation, you have the understanding, because if you don't have the understanding, it's not going to stay with you. You're going to go back to your habits. But if you know, then it's helpful. So we teach you that, and then we also give you skills. We teach you how to prepare food. We teach you how to go shopping. I mean, crazy stuff like that. And then movement. Should we be moving? One of the things where everyone's looking for convenience. Well, now we're so convenient that we just press buttons. I don't have to go to the store now. I can order it on Amazon, and I don't have to get out of the chair. And now we have artificial intelligence, so I don't even have to think. It's really getting convenient. So then I want to get a new kind of seat where I can just sit on the seat that is a toilet, and I can watch TV, and I don't have to even move. Why do we move? Okay, so remember, if it's 7,000 years ago, what would we be doing from morning to night? We'd be bending, lifting, walking. We'd be doing all that, and our body would be moving. We wouldn't have to exercise, because life that we would be living, and living would give you movement. And it turns out when you look at the studies, movement actually enhances the immune system, and lack of movement does the opposite. So movement's very important. But so anyway, we go into that, we teach you that, and you do that every day. And then lymphatics, the lymphatic system, right? That is basically the highway, the transportation and communication system of your immune system. Kind of important, kind of important. So we have lymphatic therapy, and we pay, you're going to do that at least 3 times a week, because things are congested. We're congested. I've seen tumors this big, a woman's breast. After a good lymphatic therapy, it's 3/4 the size, because most of it was congestion and stuff like that. So we got to keep things moving. Because remember, you will not drink out of a pond, but you will drink out of a river. So if it's moving, it's life, it's healthy. If it's stagnant, it's stagnant. Okay, so you don't want anything in your body stagnant. So we keep it moving. So, and the colon. You've got to clean out your colon. And if you don't think you need your colon cleaned, let me clean it out once. And when you see what comes out, tell me if you want it back. If you want it back, we'll give it back to you. But I have a feeling you won't. Okay, if you saw what was in your colon, you'd say, yes, please get that out. We clean the colon, we do all that. And basically, though, we teach you how to do all these things. How do I take care? Now, when I leave Oasis, how am I going to take care of my colon? So we teach you about enemas. We teach you how to do that. Oral hygiene, is that important? Oh, my. But by the way, the mouth never left the body. Even though we think there's two professions, dentistry and medicine, the mouth is kind of part of the body. Is it important? Well, it's how we eat. Half of our breathing is there, and it's how we speak, which differentiates us from. So it's kind of an important part of our body. And it's connected to our gastrointestinal tract, which is our biome, our gut biome. We were always talking about you got to have a balanced biome. Well, that's in the mouth, too, as well. So it's extremely important. And we know that 80% of systemic illnesses can be related back to the mouth. All right? So in addition to having you work with a biological dentist, which is imperative, a month. I mean, it's as important as seeing us. That's how important it is. Because you know what? The mouth is part of the body. We teach you what's oral hygiene. How do I take care of my mouth? What's the best way to keep it so I don't get problems? Do we know? No, we just think, right? Twice a day or once a day, we brush our teeth and, Are we done? No, we're not done, which is why we're going to the dentist all the time. All right? Do we know about oil pulling? No. Do we all floss? What do you floss with? And then how do you do medical? That's oral hygiene. How do you do medical hygiene? The other end. You got to floss the other end. Okay? And that's enemas. Okay? So you got to if you take care of this tube, this 30-foot tube, which is 10 meters, you're going to live long and prosper. If you don't take care of the tube, you're going to have problems. We're going to teach you all of that, plus the IVs, and that's what makes us different.